Hello, my name is Dr Ann-Maree Kurzydlo and I'd like to welcome you to the show. Recover Me is an online series for Australians like you and those in your family to help in better understanding some of the healthcare conditions that may impact us. We don't replace your doctor, but we do look to give you information that may help you in making more informed decisions on your own healthcare needs. You can use this information when you do talk to a healthcare professional, such as a doctor. Each of our episodes focuses on a certain condition that may have a major impact on our lives. We will hear patient stories, talk about the condition, its symptoms, diagnosis, and treatment options. Again, this information does not replace your doctor's advice, but does come from unbiased and reliable sources. Where we finish each show is an update on ongoing care, support, and any clinical trials that may be worth considering. Let's get our show on stroke underway. In this episode, we're discussing the impact of stroke in people who are in their 30s and 40s who did not expect to have a stroke at a young age.
The following stroke-related information has been provided by the Stroke Foundation. Please consult your medical professional if you have further questions and seeking medical treatment. More than 80% of strokes can be prevented. Stroke kills more women than breast cancer and more men than prostate cancer. Around 30% of stroke survivors are of working age, that's under 65. 65% of stroke survivors suffer a disability which impedes their ability to carry out daily living activities unassisted. Stroke is one of Australia's biggest killers and a leading cause of disability. A stroke happens when blood cannot supply oxygen and important nutrients to your brain cells. When brain cells don't get enough oxygen or nutrients, they die. A stroke can happen in two main ways. A blood clot or cholesterol plaque blocks a blood vessel. This is called an ischemic stroke. A blood vessel leaks or breaks. This is called a hemorrhagic stroke. In everyday life, blood clotting is beneficial. When you're bleeding from a wound, blood clots work to slow and eventually stop the bleeding. In the case of a stroke, however, blood clots are dangerous because they can block arteries and cut off blood flow.
Stroke can happen to anybody at any age. The best way to help someone is to learn the signs of stroke and know how to act fast. F is for face. Has their face drooped? A is for arms. Can they lift both arms? S is for speech. Is their speech slurred? Do they understand you? T is for time. Call 000. Time is critical. If you see any of these symptoms, act fast. Learn the signs of stroke and you could save a life.
I had a stroke at the age of 46. Before the stroke, I was quite active. I basically did a lot of cycling, a lot of mountain biking, camping, and a lot of travelling. And that's where I was prior to the stroke. Diving is one of my passions in life. Prior to that, I was actually a commercial diver on a small barge in Sydney. And then I progressed to a desk job. With that desk job, it involved I guess a lot of thinking and analysis, but to get to that desk job, that was where the cycling. So cycled from Davidson to Sydney, there and back, 50 k's a day. That shows how fairly active I was. I went to the pub a couple of nights before, then went for a dive in the morning and got back to home. Went to sleep, woke up, did a ride to work, came back, then I hit the deck. Basically crawled to the bathtub in front of my son. Didn't think that was probably the way I should have conducted myself, but I made him easy, saying that I was just doing freestyle on my back as part of an exercise routine. Went to bed and didn't wake up until about 2 o'clock the next day. My wife saw that I was obviously in either pain or something wasn't right. So she called the doctor and we raced up with the help of a friend and he called an ambulance. The only symptoms I think I could remember feeling was a little bit of dizziness and the room spinning. But then everything gave way, so my body just could not carry my weight. How I got from the bathtub to bed, I cannot remember. I'm right hemiplegic, which means that I can only operate on my left side. I've got to relearn how to use my right side. It basically stopped me from breathing and talking. That's now been fixed and progressing from there. So I'm learning how to walk, learning how to write again. Reading takes concentration, so I've got to do a lot of practice, and repetitions and goal setting is very important to reach that particular stage of my development. The treatment I received, from what I can remember, was a lot of nurses looking after me. They were obviously turning me all the time, so that I wouldn't get any bed sores. They obviously fed me and made sure that everything was cleaned. I do remember the physios coming in and visiting me and trying to move my certain, bones and legs and limbs so that I could remain a bit limber. Straight after my hospital stay, I went into rehabilitation, learning how to walk and talk, breathe again. Swallowing was a big part of it, and ingesting food from different, solid up to solids. I guess the major problem was the walking side of it, and they wanted me to become more mobile. Now, I started off in a wheelchair, a push one, where I could use my left hand to propel it. Then I progressed to a more suitable wheelchair, and then between monkey bars and learning how to keep upright. When you stay in a hospital for so long, especially the 3 months, your actual muscles and body deteriorates. And that was the major problem with me, is that all my muscles kind of just faded away. So I had to reuse them again. So a lot of that physio was about building muscle tone again, to get the walking happening. Also was the confidence. Now, learning, all of a sudden you're upright and learning how to walk again, that confidence is just gone. So you really have to trust your body, which isn't working properly, to fulfill what its duty again. I'm basically now at a stage where I'm cycling on that recumbent bike, and I do that once a week, and I'm going to the gym once a week. I go to an exercise physiologist to build up muscle. I've got a physiotherapist. I see myself as a young person that's had a stroke, and I've got a long way to go. I've got 3 kids that are, the eldest is 19, and they demand a lot out of me, being a father figure. So to do that, I have to get it into my mind that this ain't going to end now. I am basically going to have to push myself to get better as quick as I can. So with the support of friends and the support of my wife and the kids, I'm progressing towards those goals. If that means getting my body into shape by going to the gym every day, I'll do it. I want to get back on a bike. I want to get back into camping. I want to go down and play on boats again. I want to go diving again. So that is not going to stop me. Therefore, I know I have to get better. I have to use everything in my possible power to push me along that.
At the time of stroke, I was 34, working in an office environment in a marketing role for a technology company. The symptoms that I had were speech, so that was pretty apparent immediately that something was wrong, in that I was speaking to a colleague on the phone and my voice just completely went from me, so I wasn't able to form any words. At that point, the call ended, and I got up to get a glass of water, just thinking that I needed to clear my throat, and then I collapsed and fell over, and that's when my husband found me. He knew I'd been on a work call, so his initial reaction was, something's happened at work. I appeared to be upset in some way, but when he tried, asking me what was wrong, he could see I was having trouble connecting with him. He describes it as I was looking through him, It was also at that point that he noticed I had some facial issues. So you typically hear a symptom of stroke is a facial droop. For me, it was a smirk, which is unusual. He said I almost looked like the Joker on one side. So I think in that instance, he connected both the loss of speech and the facial issues that I could potentially be having a stroke, even though I wouldn't be regarded as probably somebody in the stroke demographic or the typical stroke demographic. I'm a pretty active person, like long distance running, eat relatively healthily, probably have one or two more drinks on the weekend that I should have, but as a young person that's part of the course of the weekend. But I was actually in training for the City to Surf at the time that the stroke actually occurred. So I would have regarded myself to be as fit as I could have been. The initial treatment I had was the MRI and CT scans, so that was obviously to see what was happening in the brain. Following that, the decision was made to have that thrombosis treatment. Interestingly, after the thrombosis, my voice started to be impacted again. So it had come back quite strong, and I was having a conversation. It was actually the State of Origin, the rugby league game that night. So we were having a bit of banter with the hospital staff around New South Wales versus Queensland. But my voice started to be impacted again, pretty much that I lost it completely, and that was after having the treatment. So the doctors were worried, which can be a side effect of having the treatment, that it can actually have a negative impact as well. So I was sent off for another MRI scan at that point, but thankfully there was no further damage to the brain, and we just had to wait the course out of getting the speech back through therapy. So speech therapy over the few days that I was in the hospital, and occupational therapy and physiotherapy as well, just to make sure that the joints and everything were working properly. When a young person has a stroke, or I suppose younger than the typical stroke demographic, it can almost always be put down to a hole in the heart situation. I never realised I had a hole in my heart, and I believe a third of the population have a hole in their heart. So that was what they put it down, that a wayward clot came out through that hole and went to the brain. What caused the clot? They don't know. I'd done a lot of international travel in the time leading up to the stroke. So they thought that potentially I could have had the deep vein thrombosis in your ankles and shins, but then it wasn't evident that that's where it had originated from. Given I'm relatively fit and healthy, there was no cause for cholesterol or anything like that. It was pretty much down to that hole in the heart. I did have some tests to see if my blood is prone to clotting, because that can be an issue as well. I think that's a hereditary thing in some cases, but again, that came back clear. Post-stroke, for me, the biggest impact was fatigue. Now they do talk about fatigue in stroke patients. They're not entirely sure why you have those fatigue issues, but for me, it almost took a year to get back to normal without having a nana nap during the day or having to go to bed at 9 o'clock at night. So for me, that was a big issue. I'm an early bird and a night owl, so having to be in bed early was a big impact for me. Due to the nature of work that I do as well, we get quite tired in the evening time if I had a long day or where travel might be involved. Given I'm quite a fit and healthy person, at the time of stroke I was training for the City to Surf with my partner. It was going to be the first time he'd run the City to Surf. I'd run it a number of times, but it was going to be a special one given we were running it together. So that was about 6 weeks out from when I suffered the stroke. So it was important to me to be able to get to the start line that morning in August and compete in the City to Surf. Mind you, a lot slower than I'd previously competed or run the City to Surf in, but for me it was much more than the run. It was, I suppose, getting life back on track.
I have 2 young kids. And I've been reasonably healthy, but so it was a bit of a surprise to me when I had my stroke, because I figured people don't get strokes until they're in their 50s or 60s. I feel like I would have a few more years to go before I have to really worry about my health. Generally long hours, not a lot of sleep, during the week, and pretty much a lot of office work. Didn't get much in terms of exercising, especially when I travel. Just don't have time for the hotel gym. I probably wasn't eating as healthily as I should be. And looking back, I mean, probably I was eating too much food that were high sodium, not so much greasy food, not so much oily food, but just, again, not paying a lot of attention to my health. The night before I had the stroke, I stayed up pretty late, and which is not atypical. I mean, it happened a lot. I led a busy life. And that whole day, I just felt a little bit off. I can't really tell what it was. And for example, when I was typing my email, I kept missing certain letters. When I finally got home after a day at work, I was trying to open the door and I kept dropping my key. So something was off. And finally, when I finished cooking dinner, my wife and kids already ate, and so I just prepared some dinner. I tripped over a chair, and my wife looked at me kind of strangely, and she said, "Wait a minute, was that a joke, or did you really trip?" And I said, "Okay, I'm clumsy." So I tripped, and she said, "No, just," she asked me to walk over, and even before I have all the typical symptoms, I mean, I was speaking normally, my face was fine, I didn't have that facial droop. She asked me to put my hands out, and everything was fine. She said, "No, something is off," and I was like, "It's fine." And she said, "No, you should get dressed, and I'm going to call the hospital." And by the time she went upstairs, she got dressed to go, I was sitting on the stairs. I couldn't move. So literally within the minute or two, I was like, okay, something's wrong. It turned out what I had was, again, once I went to the ER and the neurologist diagnosed what the problem was, I had a bleed in my brain. So usually strokes, I think 70% are caused by clots. Mine was a bleed. And before they managed to stop the bleeding, I had enough blood in my brain that was the size of a golf ball. I was very fortunate. I received medical attention very early on, and therefore I did not have a lot of deficits. For the first 3 to 6 weeks, I had a hard time in terms of spatial coordination. I could reach out and get something, but I really couldn't figure out the distance. I know it sounds crazy, but simple tasks like that. I lost my balance. Couldn't balance very well, couldn't walk very well. You can imagine any kind of physical activity. It was hard for me to even maintain balance. I lost sensation. I was a bit numb on pretty much all my left side. I think the stroke was a great wake-up call. The fact that I really needed to take care of myself before I can take care of my family. I don't have the 5 to 10 years before I need to start paying attention. I needed to pay attention 5 to 10 years ago. So in terms of work, I'm still in the same profession, but now I travel much less. I manage my workload. I talked about losing my balance before. I think that's a good metaphor, that I just need to strive for more balance in my life. So being able to spend more time with my family, not be so focused on work. Well, the stroke was caused by hypertension, and the hypertension also resulted in my enlarged heart. So once a year, I still go and see my cardiologist. It used to be every 6 months, but after the first 2 years, my cardiologist said, "No, you're in good shape. Just continue to maintain." And I still get nudged to lose weight a little bit, but pretty much stay with the diet, which again much reduced in terms of sodium, in terms of sugar, in terms of some of those things I need to watch out for. But I still check my blood pressure every day. I have a blood pressure monitor at home. I check that. I'm very good at taking my medicine, so that has helped control my hypertension. So a combination of medicine, a combination of lifestyle, and just paying more attention.
Now that we've heard from Ivan, Jamie and Seton about their experience in stroke recovery, it's important to understand possible reasons why stroke occurs in younger Australians. we spoke with Professor Vincent Thijs, who is the head of stroke at Austin Health in Melbourne, about the causes and what you can do to reduce the risks.
Typically, people would think that a stroke occurs at an older age, but through media and through general awareness about stroke, this has we have learned that stroke actually occurs in younger people, even in children. And the reason why that happens is maybe also because we are better at detecting stroke. We understand that stroke in the young may present a little bit differently than older, and we have educated our doctors, but also we have more easy access to advanced imaging techniques that allow a proper diagnosis of stroke. Whereas previously many symptoms would have been attributed to other diseases like migraine. When we do a brain scan, we can sometimes or often now get confirmation that it was actually a problem of the blood vessels in the brain. Another reason is our changing lifestyle may contribute to an increase in stroke. There are increasing rates of diabetes and obesity that may contribute to stroke at a younger age. But much more research needs to be done to understand why there is this increase that's noticed throughout the world in stroke occurring at a younger age. The recommendations are pretty simple and common is to exercise, is to eat healthy foods, avoid processed foods, don't smoke, check your blood pressure and your cholesterol. If we would do all these measures, that we would probably see a reduction in stroke rates also among the young. The lifestyle issue that has been brought to the attention is maybe our more hectic lifestyle as well. We work longer hours, we sleep less, we have more access to fast food and things like that. That may have also contributed. But again, it's very hard to prove that that is really the cause of this increasing rise in stroke incidence. But the challenges of stroke at a young age are quite unique and diverse. Unique because they occur at a lifetime when people have many other important responsibilities towards their partner, towards their kids, even sometimes towards their parents. So that the additional burden of a disease that comes out of the blue in most situations is obviously quite a shock. The consequences are diverse. The most visible ones would be motor impairments or problems walking, etc. But often there are also invisible impairments that people with younger stroke at a younger age sustain. And those are often affecting life in a very profound way. For instance, people will exhibit very debilitating fatigue and not being able to function more than a few hours in a day. Secondly, people will have problems in their cognition. Their memory might be off, their attention span might be reduced. When confronted with complex tasks, they will not be able to fulfill them as quickly as possible, as previously. And then there's obviously also quite a burden of depression and anxiety that are accompanied by having such a life-threatening disease at a young age. And these consequences are often not well appreciated by the surroundings, who have a traditional picture of a patient in a wheelchair as a stroke patient or a stroke survivor. And that leaves them sort of invalidated in their personal life. So this is, I think, one of the biggest challenges of young stroke. Even though people seemingly have made a good recovery, they will still have invisible impairments or not readily acknowledged impairments.
I'm Dr. Eleanor Turner, and I'm from the Impact Institute, which is the Institute for Mental and Physical Health and Clinical Translation at Deakin University. I'm also a registered clinical psychologist. I've worked clinically with people with chronic health conditions such as heart disease, respiratory disease and stroke. We've conducted a face-to-face return to work service with the Stroke Association of Victoria and Barwon Health, and this supported working age stroke survivors who were recruited into the service within the first few months post-stroke, and we found that 71% of those people returned to work in some capacity by 6 months after their stroke. Reset is a telehealth delivered return to work coordination service. What that means is that we will be delivering a service through remotely, so through telephone or video conferencing, which enables us to reach people in all different areas and to reach people who may not usually receive specialised return to work support. A case coordination service means that there is a coordination between all the different aspects that are involved in rehabilitation and recovery and the vocational aspects of return to work. And in Reset, that is done by having what we call a Reset coordinator, so like a return to work coordinator. So a single person who will communicate with all the different stakeholders, so these might be health professionals, family members, the employer and other services, and to make sure everyone's on the same page. It also involves ensuring that the stroke survivor is referred to services that they might need. For example, they might have a physical change that requires some physiotherapy intervention, and that had not yet been put in place, so that referral will be facilitated. Other common changes after stroke are changes to mood and fatigue and cognition. And so the Reset coordinator, if they detect that that's a barrier to return to work, might refer the person to a psychologist or to their GP to get a mental health plan, or they might go to a neuropsychologist or a occupational therapist to help them deal with those aspects. The Reset coordinator will also liaise with the employer and the workplace to ensure that the person is able to keep their job and return to that employment, whether in the same or an adjusted capacity. So over the next 18 months, we're going to be delivering the program to 30 working age stroke survivors. We'll be looking for people living in southwest Victoria. They can talk to the stroke staff at their local hospital who can put them in touch with us.
Thank you for watching Recover Me on Stroke. Please keep a lookout for our new shows in the series. Until next time, this is Dr Ann-Maree Kurzydlo wishing you good health.
Recover Me captures patient stories, interviews with healthcare professionals, and presents information supplied by health charities for the purposes of promoting public health literacy in an engaging and accessible manner. This information is for awareness only and should not be used for treatment. Please consult your medical professional if you have further questions and seek medical treatment.